Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Basic care and comfort. The nurse is instructing a 65-year-old female client diagnosed with osteoporosis. The most important instruction regarding exercise would be to: Option A. Exercise doing weight-bearing activities. Option B. Exercise to reduce weight. Option C. Avoid exercise activities that increase the risk of fracture. Option D. Exercise to strengthen muscles and thereby protect bones. Right answer is Option A. Exercise doing weight-bearing activities. Weight-bearing exercises are beneficial in the treatment of osteoporosis. Although loss of bone cannot be substantially reversed, further loss can be greatly reduced if the client includes weight-bearing exercises along with estrogen replacement and calcium supplements in their treatment protocol. A client in a long-term care facility complains of pain. The nurse collects data about the client's pain. The first step in pain assessment is for the nurse to: Option A. Have the client identify coping methods. Option B. Get the description of the location and intensity of the pain. Option C. Accept the client's report of pain. Option D. Determine the client's status of pain. Right answer is Option C. Accept the client's report of pain. Although all of the options above are correct, the first and most important piece of information in this client's pain assessment is what the client is telling you about the pain, the client's report. Which statement best describes the effects of immobility in children? Option A. Immobility prevents the progression of language and fine motor development. Option B. Immobility in children has similar physical effects to those found in adults. Option C. Children are more susceptible to the effects of immobility than are adults. Option D. Children are likely to have prolonged immobility with subsequent complications. Right answer is Option B. Immobility in children has similar physical effects to those found in adults. Care of the immobile child includes efforts to prevent complications of muscle atrophy, contractures, skin breakdown, decreased metabolism and bone demineralization. Secondary alterations also occur in the cardiovascular, respiratory and renal systems. Similar effects and alterations occur in adults. After a myocardial infarction, a client is placed on a sodium-restricted diet. When the nurse is teaching the client about the diet, which meal plan would be the most appropriate to suggest? Option A. 3 ounces broiled fish, 1 baked potato, half cup canned beets, 1 orange, and milk. Option B. 3 ounces canned salmon, fresh broccoli, 1 biscuit, tea, and 1 apple. Option C. A bologna sandwich, fresh eggplant, 2 ounces fresh fruit, tea, and apple juice. Option D. 3 ounces turkey, 1 fresh sweet potato, half cup fresh green beans, milk, and 1 orange. Right answer is Option D. 3 ounces turkey, 1 fresh sweet potato, half cup fresh green beans, milk, and 1 orange. Canned fish and vegetables and cured meats are high in sodium. This meal does not contain any canned fish and/or vegetables or cured meats. A nurse is assessing several clients in a long-term healthcare facility. Which client is at highest risk for development of decubitus ulcers? Option A. A 79-year-old malnourished client on bed rest. Option B. An obese client who uses a wheelchair. Option C. An incontinent client who has had 3 diarrhea stools. Option D. An 80-year-old ambulatory diabetic client. Right answer is Option A. A 79-year-old malnourished client on bed rest. Weighing significantly less than ideal body weight increases the number and surface area of bony prominences which are susceptible to pressure ulcers. Thus, Malnutrition is a major risk factor for decubitus, due in part to poor hydration and inadequate protein intake. Mrs. Kennedy had a CVA, cerebrovascular accident, and has severe right-sided weakness. She has been taught to walk with a cane. The nurse is evaluating her use of the cane prior to discharge. Which of the following reflects correct use of the cane? Option A. Holding the cane in her left hand, Mrs. Kennedy moves the cane forward first, then her right leg, and finally her left leg. Option B. Holding the cane in her right hand, Mrs. Kennedy moves the cane forward first, then her left leg, and finally her right leg. Option C. Holding the cane in her right hand, Mrs. Kennedy moves the cane and her right leg forward, then moves her left leg forward. Option D. Holding the cane in her left hand, Mrs. Kennedy moves the cane and her left leg forward, then moves her right leg forward. Right answer is Option A. Holding the cane in her left hand, Mrs. Kennedy moves the cane forward first, then her right leg, and finally her left leg. When a person with weakness on one side uses a cane, there should always be 2 points of contact with the floor. When Mrs. Kennedy moves the cane forward, she has both feet on the floor, providing stability. The nurse is instructing a woman in a low-fat, high-fiber diet. Which of the following food choices, if selected by the client, indicate an understanding of a low-fat, high-fiber diet? Option A. Tuna salad sandwich on whole wheat bread. Option B. Vegetable soup made with vegetable stock, carrots, celery, and legumes served with toasted oat bread. Option C. Chef's salad with hard-boiled eggs and fat-free dressing. Option D. Broiled chicken stuffed with chopped apples and walnuts. Right answer is Option B. Vegetable soup made with vegetable stock, carrots, celery, and legumes served with toasted oat bread. Mayonnaise and tuna salad is high in fat. The whole wheat bread has some fiber. This choice shows a low-fat soup, which would have been higher in fat if made with chicken or beef stock, and high-fiber bread and soup contents both the vegetables and the legumes. Salad is high in fiber. An 85-year-old male patient has been bedridden for 2 weeks. Which of the following complaints by the patient indicates to the nurse that he is developing a complication of immobility? Option A. Stiffness of the right ankle joint. Option B. Soreness of the gums. Option C. Short-term memory loss. Option D. Decreased appetite. Right answer is Option A. Stiffness of the right ankle joint. Stiffness of a joint may indicate the beginning of a contracture and/or early muscle atrophy. Soreness of the gums is not related to immobility. Short-term memory loss is not related to immobility. Decreased appetite is unlikely to be related to immobility. An 11-month-old infant is brought to the pediatric clinic. The nurse suspects that the child has iron deficiency anemia. Because iron deficiency anemia is suspected, which of the following is the most important information to obtain from the infant's parents? Option A. Normal dietary intake. Option B. Relevant socio-cultural, economic, and educational background of the family. Option C. Any evidence of blood in the stools. Option D. A history of maternal anemia during pregnancy. Right answer is Option A. Normal dietary intake. Iron deficiency anemia occurs commonly in children 6 to 24 months of age. For the first 4 to 5 months of infancy, iron stores laid down for the baby during pregnancy are adequate. When fetal iron stores are depleted, supplemental dietary iron needs to be supplied to meet the infant's rapid growth needs. Iron deficiency may occur in the infant who drinks mostly milk, which contains no iron. A 46-year-old female with chronic constipation is assessed by the nurse for a bowel training regimen. Which factor indicates further information is needed by the nurse? Option A. The client's dietary habits include foods high in bulk. Option B. The client's fluid intake is between 2,500 to 3,000 milliliters per day. Option C. The client engages in moderate exercise each day. Option D. The client's bowel habits were not discussed. Right answer is Option D. The client's bowel habits were not discussed. Foods high in bulk are appropriate. Exercise should be a part of a bowel training regimen. To assess the client for a bowel training program, the factors causing the bowel alteration should be assessed. A routine for bowel elimination should be based on the client's previous bowel habits and alterations in bowel habits that have occurred because of illness or trauma. The client and the family should assist in the planning of the program, which should include foods high in bulk, adequate exercise, and fluid intake of 2,500 to 3,000 milliliters. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.